Welcome to Regen MDI. I am Dr. Gurpreet Singh Padda. If you are watching this, it is likely because hip pain has begun to dictate the terms of your life. We are located here in St. Louis at 4477 Woodson Road, right near the airport. My background is as a triple board certified physician. With over 30 years of experience in anesthesiology, interventional pain, and metabolic health, I've spent my career identifying the signals the body sends when it drifts out of balance. Today, we are discussing a strategic framework for hip preservation. We look at the biological soil, the metabolic environment that dictates joint health. The traditional orthopedic model often follows a wait-and-see approach, deferring intervention until a joint reaches catastrophic failure. At Regen MD, we have superseded this. We believe that to maximize your longevity, we must exhaust biological alternatives that address the root cause of joint decay before committing to the risks of surgery. Many people view osteoarthritis as simple mechanical wear and tear, like a sponge losing its fluid, but we define it as a complex inflammatory protein response. While X-rays show structural degradation, it is the biological fire of inflammation, the meta-inflammation, that actually dictates your pain signal. Think of the fire analogy. Traditional surgery often focuses on moving the sticks, the mechanical components. Interventional orthobiologics focus on putting water on the fire. Our protocol shifts the focus from structural salvage to modulating your body's own signaling pathways. This model prioritizes the biological environment, preserving your native anatomy while you are still active enough to enjoy it. This is about maintaining your metabolic sovereignty. Surgery is often presented as a routine cleanup, but the mechanical reality of hip arthroscopy is aggressive and high stakes. To even get a camera into the joint, surgeons must apply 60 to 80 pounds of traction to literally pull the ball out of the socket. This maneuver puts the large femoral nerve under extreme tension. If neurological signals are lost during the procedure, you face a high risk of permanent nerve damage. Furthermore, there is a profound expectation gap regarding total hip arthroplasty. Many anticipate a 100% return to a youthful baseline. The reality is typically an 80 to 95% improvement. For younger patients in their 30s or 40s, this carries a looming strategic crisis. With a 15 to 20-year prosthesis lifespan, you are virtually guaranteed to require a revision surgery, an exponentially more complex procedure. We utilize a biological hierarchy that escalates based on the severity of your condition. We start with the least invasive, most biological options first. Step 1. Viscosupplementation and Toradol. We use hyaluronic acid as a strategic paving of the pothole, restoring joint lubrication. We pair this with Toradol, which calms the biological fire without the cartilage-weakening effects of traditional corticosteroids. We avoid the metabolic damage. Step 2. Platelet-rich plasma. This is a disease-modifying intervention. We concentrate growth factors from your own blood to alter the joint environment. By concentrating these signals, we move beyond pain masking. We are literally changing the terrain of the joint from catabolic to anabolic. Step 3, bone marrow aspirate concentrate, or BMAC. This is the pinnacle of our hierarchy, addressing deep chondral damage. We address CLJ breakdown using a precise megaclot formulation, concentrated BMAC rich in stromal cells combined with PRP and thrombin. This scaffold is deployed to promote repair at the cellular level. It is about architectural restoration of the joint's structural integrity. The strategic value of orthobiologics is found in their longitudinal durability. Landmark data from Martin and colleagues has redefined our understanding. In this prospective cohort study, BMAC was used to augment arthroscopic labral repair. The functional scores at 5 years were profound. Patients in the BMAC group reported significantly higher functional scores and quality of life scores compared to those receiving mechanical repair alone. A critical takeaway is the time-dependent effect. The differences often don't appear until the 24-month mark. This is a cumulative process. Biological repair is a durable process that actually improves over time as the body re-architects the joint environment. It's an investment in your future. The ultimate metric of success is survivorship, the ability to avoid a prosthesis. This is vital in high-stakes cases like a vascular necrosis or AVN. A 2024 systematic review proved that orthobiologic augmentation changes the trajectory. At 10 years, we see 69% survivorship. Specifically, BMAC demonstrated the most significant benefit in postponing a total hip replacement. For a patient in their 30s, this is a life-altering victory. The biological approach represents a more sophisticated path for the active patient. It is built on 5 strategic pillars that define our protocol. Pillar 1, safety. We eliminate the risks of aggressive traction and potential permanent nerve damage associated with traditional surgery. Pillar 2, disease modification. We extinguish the inflammatory fire rather than just reacting to mechanical failure when it's too late. Pillar 3, functional longevity. Level 1 data proves superior outcomes in sports and daily living that actually improve over time. Pillar 4, joint preservation. We statistically delay the need for a total hip replacement, protecting your native biology. Pillar 5, rehabilitation synergy. Biologics provide a window of opportunity. By quieting the fire, we allow physical therapy to fix biomechanical issues. There is a finite window of opportunity for preservation. Once the joint reaches end-stage degradation, surgery becomes the only option. At Regent MD, we invite you into a partnership. You are no longer stuck in a failing system. Reclaim your autonomy with a roadmap grounded in precision. I look forward to seeing you at our Woodson Road Clinic in St. Louis and helping you heal the underlying terrain. Thank you for watching.